Hello, and welcome back. In Chapter 10, we're discussing somatic symptom and related disorders. These are disorders that are distinguished by the prominence of somatic symptoms associated with significant distress or impairment and may be accompanied by actual medical disorders. Those with somatic symptoms and related disorders really believe they have something seriously wrong with them and causes enormous anxiety, distress, and impairment. So these are people who feel they have some kind of medical ailment or symptoms of medical conditions or whatnot that's causing distress or impairment. The assessment is not always clear cut, just vague complaints, and may in fact be culturally acceptable and adaptive behaviors. So let's talk about somatic symptom disorder. This is characterized by recurrent, multiple bodily and physical somatic complaints seen by multiple occurring somatic symptoms that cause distress or result in significant disruptions in a person's daily life. With excessive thoughts, feelings, and behaviors seen by at least one of the following: excessive time or energy devoted to health concerns, tend to worry a lot about having an illness. Health concerns play a central role in life and must be present for at least 6 months, so you have to meet that duration. Illness anxiety disorder. This is characterized by having physical complaints that are without a clear cause, seen as a preoccupation with having or getting a very serious or undiagnosed illness. Absence of somatic symptoms, but if present, they are very mild. Anxiety having around something physically wrong with is the source of the person's distress. Repeatedly check for signs or illnesses, or even avoids going to the doctor to check things out. Symptoms are present for at least 6 months. If medical care is really used, a specified care avoidant type can be assigned. Conversion disorder, right? Or functional neurological symptom disorder. This is characterized by a loss or a change of physical functioning that suggests the presence of a physical disorder but cannot be explained on the basis of a known physiological mechanism. Has one or more symptoms of altered voluntary motor or sensory function. Symptoms are not explained by a neurological disease. In other words, the symptoms typically do not conform to the known automatic pathways, disease processes, or physiological mechanisms. Basically, those symptoms are not really there, or they don't conform to the normal symptoms that someone would have for that medical disorder. Another disorder does not explain the symptom picture, or distress is caused by personal, occupational, or other important life areas. So physiological factors affecting other medical conditions. This is characterized by a number of psychological factors ranging from the mood, the personality disorder, and response to stress or pain that can have an adverse effect on the body's physical condition. The person has a symptom as well as significant psychological or behavioral factors that adversely affect the medical condition become evident in one of several ways, such as delayed recovery, poor adherence to treatment, or increased health risk, or exacerbating symptoms, and are not better explained by another mental disorder. Factitious disorder. The features of physical and psychological symptoms that are intentionally produced are completely under the person's voluntary control, but there is no obvious reason for the voluntary producing the symptoms except possibly to take on the sick role or receive increased attention, provides misleading information, represents him or herself as others are sick, injured, or impaired. Behavior is evident even in the absence of obvious external rewards. It is not better explained by another mental disorder. Factitious disorder imposed on another, right? So this is formerly known as factitious disorder by proxy. The features is falsification of medical signs or symptoms on self or others. A variant of factitious disorder involves falsification of injury or disease in another associated with identified deception. The individual presents another to others or as impaired or injured. The perpetrator, not the victim, receives a diagnosis, evident in the absence of obvious external rewards, and not better explained by another mental disorder. So when we compare the DSM-4 to DSM-5 from this section, somatoform disorders are called somatic symptoms and related disorders now. The number of diagnoses have been reduced with somatization disorder, hypochondriacism, pain disorder or undifferentiated somatic disorder were deleted. Those with chronic pain can now be diagnosed with somatic disorder with predominant pain or psychological factors that affect other medical conditions. And somatization disorder and undifferentiated somatoform disorder are combined in DSM-5 to become somatic symptom disorder. And somatic symptoms and related disorders are defined as by positive symptoms, and medically unexplained symptoms are minimized except in the case of conversion disorder and pseudopsychosis. Criteria for conversion disorder were changed, and the DSM-5 now includes a new diagnosis: psychological factors affecting the other medical conditions.